Good afternoon and welcome to our June Care Center webinar. Very excited to have Zabin Patel present today on looking for, finding, and choosing a therapist for my child. Ms. Patel is about 5 minutes away from getting her PhD. She's just completing her internship and her fellowship with us in the Care Center. She is from Chicago and is receiving her PhD from the University of Miami. And she will soon be going back to Chicago for a fellowship in dissemination and implementation of mental health treatments. So it's my great pleasure to introduce Zabin for this webinar.
Thank you so much, Dr. Pasentini, for the introduction, and thank you all for joining us tonight. I am so excited to present on this topic because it's so incredibly close to my heart. I'm going to be talking about things that you should be looking for when you're considering finding a therapist for your child. Of course, anyone is welcome to join us tonight, but this talk is really geared towards parents and caregivers who are looking for a mental health professional for their child. Finding a therapist, as much as I wish were an easy process, actually involves several steps. And I really hope today I can give you a broad overview of that journey. So we'll begin with the first step, which is you noticing that your child is having some difficulties and you want to get them help, and where do you even begin? And then we'll move on to step 2, where you think you've found someone. How do you know that this therapist is the right fit for your child and your family? And then I want to give you a bit of an overview of some types of child therapies, and we'll talk about what your role in treatment can look like. And we'll end with what you can expect during initial treatment sessions. Before I begin, I want to acknowledge that the mental health system can sometimes feel like a mystery, and finding a therapist can feel confusing. Therapy can be expensive, and taking the first step to find help can feel incredibly overwhelming. And that's for adults, right? So with children, there are some additional questions to consider, like how is my child's behavior developmentally appropriate, or how much should I be involved in my child's treatment sessions? And so I hope these are some of the questions that I can touch on a bit today. So before you begin to look for a therapist, the first thing you need to do is think about whether your child needs therapy. Sometimes kids may need help with their big feelings and problems. Children these days are growing up in a pandemic, juggling Zoom learning and navigating peer relationships on social media. And I'm sure sometimes that can feel like a lot to handle. And so the first question that you may want to ask yourself is, does my child need mental health treatment, or is this kind of a part of typical development? And the best way to tell the difference between those two questions is to really first take stock of what's happening. What are you noticing? What is the specific behavior that you see, and does it pop up in different contexts? So when your child is at school, and when they're with their friends, and when they're at home. Finding patterns can really help you get an overall picture of what's going on, and then you can use that information to give to your child's therapist when you are able to connect. After you've identified a behavior, and when you're looking for these patterns, there are 3 guiding points to keep in mind, and that is intensity, duration, and 3, consistency. So for intensity, you want to notice how intense is the behavior that's happening. So I like to think on a scale of 0 to 10, how difficult is this behavior for you or your child to manage? And next, you want to look at duration. So how long is this behavior lasting? Does it happen minutes or days, or has it been going on for several weeks or even months? And last, you want to look at consistency. So consistency or frequency. So how often is this behavior occurring, and does it happen across different areas of your child's life? So again, at home, when they're at school, and when they're with their friends. So let's say, for example, your child is feeling a little anxious and they tell you that they're worried about going to school. They say they're worried a couple of times before a big test, but you notice that they're working really hard and they're studying and they're still going to school and hanging out with their friends. And their worries calm down after the test ends. That's a little different in intensity, frequency, and consistency, or intensity, duration, and consistency, than a child that says that they're worried they're going to fail school every single day for multiple hours a day and has said this for about a month. You, because you've been taking stock as a parent, have found that they're not being bullied at school, but they also don't want to hang out with their friends anymore because they're so nervous about school. While this child may be experiencing typical levels of stress, this child's anxiety is really getting in the way for them, and it may be time to consider getting them some help. When looking for a child therapist, the second thing to think about is what level of care do they need? In very broad strokes, as you go up this ladder, higher levels of care provide your child with more therapeutic support. At the very bottom, we have outpatient services, which is what most people think about when they think of weekly therapy. And that's where we'll be spending most of our time today. But we also have intensive outpatient services, partial hospitalization, residential treatment, and inpatient hospitalization. So beginning at the top and working our way down, inpatient hospitalization is used for patient stabilization. If your child is expressing or acting on suicidal thoughts and you feel like you cannot keep your child safe, you can always walk into any emergency room department. In the ER, your child will typically receive an assessment by an ER staff who will help determine if your child is a danger to themselves or a danger to others, and admit them to a child psychiatric unit if needed. While in the unit, a child will receive various different services. So these often include individual and group therapy and medication management by a psychiatrist, but stay is meant to be short-term. So typically that's about 1 to 2 weeks. And the goal is really to get the child transferred to a lower level of care. For children whose mental health care needs don't require inpatient hospitalization, so that's the highest level of care, but can't be managed outpatient, so at the lower levels of care, there are a couple of options available, and these include residential treatment or partial hospitalization. Residential is more of a live-in treatment facility, while partial is a day treatment program where kids go for about 5 to 6 hours a day, 5 days a week, kind of like a school, and then they go home after. Both of these levels of care are meant to provide a child with a safe and structured environment to get support with their mental health care needs through various different therapeutic activities. And again, stay is meant to be short-term, so that's typically about 1 to 2 months. And now moving down to outpatient services. And again, this is what most people think of when they think of therapy, right? So let's begin with intensive outpatient, or IOP. IOP is for children who need more than once or twice weekly therapy. IOPs can be incredibly specialized. So there are IOPs for eating disorders, IOP for mood disorders, or for OCD. And children typically attend about 5 days a week for a couple of hours a day. And last, we have weekly therapy. So these are typically 50 to 60-minute sessions with a therapist. And they can happen, and these sessions can happen in a variety of different formats. So you can have individual therapy, which is one-on-one sessions with a therapist, or you can have family therapy, which includes all members of your family unit, or you can have group therapy, which usually brings together children, usually with similar difficulties, so that they can learn together and have peer support. And I also wanted to let you know that these levels of care are not static, and children can go in between these different levels of care if needed. Okay, so let's say in our journey together, you have been taking stock of what's been happening with your child, and you have been taking notes on their behavior. And you come to the conclusion that, yes, your child needs professional support and you would like to pursue treatment. You've also realized that weekly one-on-one therapy is where you would like to begin. So the question now is, where do you start? And my advice to you is to first ask yourself, who am I looking for? Because there are various different types of mental health professionals and different reasons that you may want to consult one. Very broadly, mental health professionals fall into two categories: those that can prescribe and monitor medications, and those that specialize in the assessment of emotional and behavioral problems and behavioral intervention. And if you notice that these two Venn diagrams overlap, that's because there's also some shared overlap in the responsibilities of both of these two broad categories. All of these professionals vary in their level of education, they vary in their training, they vary in their specialty. So it's important to remember that this slide doesn't include all the different types of mental health professionals out there, but I hope it provides you with a broad and general overview. Okay, so let's start with primary care physicians, or PCPs and pediatricians. PCPs and pediatricians can provide children with medication for problems like anxiety or ADHD, and are important allies in your child's big picture health, right? I always like to point out to parents that most children will regularly see a pediatrician, but only a few will ever see a psychologist, right? And there are also shortages of mental health professionals in parts of the country. And so more and more PCPs and pediatricians are being trained to provide mental health care to children. Then we have psychiatrists. Psychiatrists are physicians, so they are medical doctors with psychiatric training. And some go on to complete an additional fellowship in child and adolescent psychiatry. Psychiatrists can diagnose and treat mental health conditions, prescribe and monitor medication, and provide therapy. If you're looking for a behavioral intervention, you're more likely going to look into professionals that specialize in assessment and therapy. So the first group of professionals are psychologists. There are many different types of psychologists out there. There are clinical psychologists and counseling psychologists and school psychologists. But broadly, these are individuals that have a doctorate in psychology. They can see children, couples, families, and often use psychotherapy as their primary treatment approach. Unlike psychiatrists, in most states, psychologists cannot prescribe medication. Unlike psychiatrists, in most states, psychologists cannot prescribe medication, but they are trained to provide psychoeducational testing, which can help answer if a child has cognitive concerns. The next group of mental health professionals is licensed clinical social workers and/or marriage and family therapists, who are both master's level clinicians and the largest group of mental health professionals in the United States. Social workers typically have more training in case management, so helping coordinate the different types of services a child may need. And family therapists are trained to specifically address mental health issues in the context of relationships. And last, we have mental health counselors who are often employed in schools or in hospitals or in various similar settings, but they can help children manage stress and focus on challenges. So things like divorce, switching schools, and navigating relationships. All of the providers in pink can provide therapy and help you assess what level of care your child needs. But one of the most important things a therapist can do is offer you the information and vocabulary you need to better understand what is going on with your child. The next question you're probably wondering is, where do I look for a child therapist? And if you're like most of the parents I know, you're probably turning to Google. And the first place most people start is an online therapist directory, which is an online webpage where professionals can list their credentials, the types of clients that they work with, and also their specialty. Common therapist directories include Psychology Today, Therapy Den, Good Therapy. But we really encourage you to look for therapists on the websites of professional organizations. So 3 websites that are good resources include effectivechildtherapy.org, which is run by the Society of Clinical Child and Adolescent Psychology, and abct.org, the Association for Behavior and Cognitive Therapies, as well as adaa.org. And the last website is particularly helpful if your child is struggling with anxiety or depression. The reason to go through a professional organization is that these therapists are vetted so that you know you're more likely to get a professional specializing in working with children and using a type of treatment that works, which we'll talk about in a bit. Your second option is to go through your health insurance. So you can call your insurer's information and ask for professionals who accept your insurance plan in your area. Therapy coverage can vary a lot between insurance plans, and if there is a specific concern your child has, you can ask for providers with that specialty. I always like to let parents know that many providers with specialized training do not take insurance because the reimbursement rates are low. But if you have PPO, you can get some or all of the out-of-network cost reimbursed. That's definitely something to ask your insurance about. If you don't have mental health insurance or health insurance and you cannot pay out of pocket because the costs are high, you can contact your local community mental health center, and their information is often available through a public library. Or you can also look into getting a therapist at a university training clinic. So these are clinics typically associated with the university that have therapists that are training and are working under the license of a supervisor. And often these training clinics have sliding scale fees, so you pay per session based on your income, as opposed to a fixed weekly rate. Okay, so now you've reviewed the different types of mental health professionals and you've researched your options via insurance. You may have landed on someone. And so the question you're wondering about now is, how do I know the person that I found is a right fit for my child? And I always like to tell parents, therapy is a professional relationship, right? And it's really all about your family's needs. You, your child, and your child's therapist are all collaboratively working together towards their goals and your family's goals. And the right match is incredibly important. One of the best indicators of match is your child's comfort level and someone who will collaboratively support you and your child and your family towards your family's goals. In your initial consultation with a therapist, you are seeking advice, but it's also reasonable to ask them questions. And here are some questions that you may want to ask during your initial meeting. So first, learning more about the therapist training background and whether they are licensed. I know this seems basic, but it's misleading for someone to call themselves a therapist without proper training. And many continue to do so, so please be aware. You may also want to ask about their background in working with children and families similar to yours, or if there's a specific issue that you need particular help in managing. I'd also ask about what types of treatments they provide, which again, we'll get into in just a minute, and whether they can provide you with a treatment plan. So a treatment plan is an outline that talks about how a therapist will address your child's difficulties, and it can be an incredibly helpful way for you and your therapist to just have a shared understanding of what's going on, and it can also help you to track treatment progress. You can also ask about session structure, so how long sessions will last, the types of activities that they will do with your child as well as you, and how often they plan on meeting. So now that you found a therapist, ask them questions. You may be wondering what child therapy looks like and what your role in treatment may be. It's important to remember that mental health treatments for children are not all equally helpful, and some therapies work better than others. Treatment needs will vary from child to child, and even two children with the same diagnosis or same symptoms can have very different experiences in therapy. Mental health providers use a lot of different approaches to help children. Some are based on science and others are not. Treatments that are based on science, treatments that work, and treatments that are based on research are often called evidence-based treatments. There are many different types of evidence-based treatments for children depending on their specific concerns, but a couple examples are cognitive behavioral therapy, or CBT, with exposure, and for younger children, parent training, an example of which is parent-child interaction therapy. Oftentimes, parents believe that therapy is a place where children can go and talk to a therapist about their problems, all of which is true. But therapy can also be an active process where children learn skills to manage their behaviors and worries, and parents can learn skills to manage their child's behaviors and worries. So let's start with CBT. Cognitive behavioral therapy, or CBT, is a structured, goal-focused, and time-limited treatment used with children that have anxiety and depression. It can be used alone or in combination with medication if your therapist is a psychiatrist or if your therapist is working with a psychiatrist. And during a session, a therapist works with a child to work through their fears or worries through a step-by-step process called exposure. In the long term, with exposure practice, a child learns that they can manage their strong fears or their strong feelings. So here's an example of a child that was really afraid of dogs when she first started treatment. And her therapist helped her come up with an exposure plan. And towards the end of the treatment, you see that she can give the puppy a treat. Another example of a treatment that works, especially for children younger than 7, is parent training. So this is actually where you, the parent, are delivering all of the therapy skills. So for kids that are showing aggressive behaviors or excessive tantrums, an evidence-based treatment is parent-child interaction therapy, or PCIT. And in PCIT, parents learn, so here's the parent, here's their child. Parents learn play skills and discipline techniques from a therapist who watches behind a one-way mirror and provides live feedback to the parent with a bug in their ear. Parent training can be a really helpful way to teach parents more helpful skills to interact with their children, which can have better outcomes for them long-term. So how do you know if your child is getting a treatment that works? Well, there are some themes across evidence-based treatments that are helpful to know about. First, your child may become more aware of their strong feelings and emotions because your therapist is helping them examine their thoughts, their thinking patterns. The therapist is also helping them examine the mind-body connection, so how their strong feelings may show up in their body and how their strong feelings are related to the behaviors that they're engaging in. That's really the essence of CBT. Next, your child's therapist will likely give them or you in session or in between session homework so that they can practice the skills that they're learning in session during their everyday lives. And last, they will have coping skills that will help them approach situations that they were previously avoiding in the past. Okay. Another question I often get asked is, what is my role in my child's treatment? So how you will participate and how often you will participate in your child's treatment depends on your child's age and the nature of the problem you're pursuing therapy for. So in some situations, especially when a child is younger, like in parent training, it would be very important that you are closely involved in treatment, right? But if your child is older or an adolescent, privacy between the therapist and your child becomes much more important to a therapeutic relationship. In any case, it's important that you ask your child about your role. You can ask your child's therapist how often they plan to meet with you and if they plan to gather additional information about your child through the school or a school counselor. And though therapy is not meant to be a quick fix, you can also ask them how long your child may be in therapy and the types of skills your family may be learning. Okay, so we're nearing the end, but now you've met with your child's therapist, reviewed treatment options, and you've clarified your role in treatment. What can you expect during the first session or the first initial sessions? Typically, the first couple appointments are your therapist getting to know your child's story and you and your child getting to know them. This is what's usually called an intake or assessment and feedback session. Sessions 4 to 5 is a good time to check in and reflect on how things are going. How have the first few sessions been? How is the therapeutic relationship? How is your child getting along with their therapist? These are some questions that you may want to consider. As your child progresses through treatment, another major milestone to consider is termination. Have you noticed changes in their feelings and behavior? And has your child made progress towards their treatment goals? Last, I wanted to leave you with some additional resources about child therapy. If you're waiting on an appointment, or if you wanted some direction or some additional supports in the meantime. firsteffectivechildtherapy.org is a website which has a helpful FAQ section for parents and a child therapist directory. The UCLA Empower Clinic and ACOMA project are particularly helpful for youth with marginalized identities, including sexual and gender minority youth and youth of color, to access mental health information that may be more relevant to them. Therapy for the People is a directory of low-cost care and treatment options, which you may want to peruse. The Lab for Scalable Mental Health, if you click on this QR code, it will take you to the link, from Stony Brook University, has a number of free, brief, and online interventions for teens with anxiety and depression that are freely accessible on their website. And we also have NAMI, the National Alliance on Mental Illness, a national nonprofit organization involved in mental health advocacy efforts for youth and adults. And of course, we have the UCLA Care Center, where you can go to the anxiety tools page for tip sheets and skills to help manage your child's anxiety. These resources are all free and available in both English and in Spanish. That's all I have for you today, but I am happy to take questions and begin a conversation. And again, want to thank you all for joining us today. Stop share.
Thank you, Zabin. That was a really excellent talk. Very much appreciated. A lot of great information. A couple questions. What do I do if I don't think my therapist is being helpful or using some of the techniques that you said are important? Can I change therapists?
I think you always have a right to change a therapist. That's definitely within your power. But I think it's an important point to begin a conversation with the person that you're working with, or the person that your child is working with. I think if a therapist has been checking in with you as a parent kind of regularly, right, and you had set that expectation from the beginning that you would be involved in your child's care, at least in some capacity, hopefully you are kind of a little bit more aware of the types of skills and the types of activities your child is engaging with your therapist in during sessions. But I'd really encourage you to ask and open a conversation about some of the techniques that we talked about today, including exposure, including identifying some additional skills to help manage your child's worries or problem behaviors.
Right. And another question: do you how long does treatment usually last? Does it depend on the therapy, or can I predict how many weeks it will be?
Great question. I think that there's a two-part answer. One, in that sometimes it can depend on the therapy. It can also depend on the therapist. Again, a great question to ask kind of at the initial onset of when you pursue a conversation with a therapist of how long they typically see children, how long children typically stay in their care. But I will say that the types of treatments that I talked about today, so that's cognitive behavioral therapy with exposure and parent training, or parent-child interaction therapy being a specific example, are time-limited and goal-oriented treatments. So typically a CBT treatment course, from the first treatment session to the last treatment session, may be about 20 weeks. And hopefully during that 20-week period, you do see some gains towards the situations or the people, places, or triggers your child was initially avoiding. So those, as well as PCIT, it's not meant to be a treatment that goes on forever. It's meant to be a time-limited intervention.
Good, thanks.
Mm-hmm.
Another question: if I think my child suffers from anxiety and maybe some depression. Mm-hmm. Should I look for an anxiety therapist or a depression therapist, or what? How do I manage that?
That's also a great question. I think that oftentimes disorders like anxiety and depression, especially in teens, happen together. And so a skilled therapist or someone who is skilled in using a treatment like cognitive behavioral therapy will be able to flexibly apply lots of the principles that come with the treatment to either disorder. And they can also help you determine which disorder is most affecting your child in those three areas that we talked about earlier. So that's frequency, duration, and consistency, and start there. So that's what we would call a primary treatment target. And again, a treatment like cognitive behavioral therapy is very goal-oriented. So your therapist will be working with you not just in the context of these disorders, but also in the context of your family's goals and helping your child approach situations that they may be avoiding.
Thank you. When should I do family therapy? I've heard people talk about family therapy, and I don't know, can you talk a little bit more about what that might be useful for? Because I do see my son's therapist also, and I don't know why family therapy I might need that as well.
So family therapy can be particularly helpful when lots of the symptoms and difficulties that you're seeing in your child may be relational or kind of embedded within the family unit. Again, the types of treatments that I talked about today can be delivered both one-on-one format, so with an individual therapist, and that's typically how I work, or they can be used in a family-centered or by a family-centered therapist. Lots of different, again, professionals may vary in how they use treatments like CBT and what formats they use these treatments. And it's a really important question to ask the particular provider that you're working with. But my short answer would be, if you find that really you're having a lot of relational conflict, it may be a sign to pursue family therapy.
Great, thank you. And let's see if there are any other questions. I think that's it. So thank you very much, Zabin. This was really, really helpful and very informative. So appreciate you doing this webinar for the Care Center.
You're so welcome. Thank you for having me and giving me the opportunity.
Okay. Bye, everyone. Stay tuned for our next webinar. We're skipping July, but we will have a back to school webinar sometime in August. So keep tuned for when that announcement comes out. Bye.